Welcome back to AM Buffalo. I took a trip to the Aesthetic Associates Centre to have a chat with Dr. Sam Shatkin about, well, the fact that they've reopened now and they have a different kind of way of doing things because of the pandemic, but also they have some amazing options. If you snacked a lot while you were in quarantine and lying low, the Aesthetics Associates Centre have some amazing options for you. And there might be something that works. So check this out, Dr. Sam Shatkin. The Aesthetic Associates Centre is back open for business, and we are catching up with Dr. Sam Shatkin to find out what precautions they're taking with the new normal.
Well, right. So, we've always been careful in our practice about cleanliness and sanitation, but, obviously now we're being more cautious. We're taking a lot of new precautions in our practice, including everybody that wears a mask that comes to the office. In the plastic surgery patients, they're all getting phone calls from the parking lot to tell them when they can come in, so we know that they're not going to be waiting for too long a time in the waiting area. And then we check their temperatures, obviously, when they come in. We're following all the CDC protocols, and so far the patients have been very accepting of that.
And as a medical professional, you know how to do this better than anyone.
Well, yes, I believe we do, and that's a good comment, because there are a lot of businesses that are just learning the protocols, but we've been doing this now. I've been in practice 31 years, and we've been doing those types of things, regularly, but now it's a little bit more to light now. And of course, we're wearing the masks to protect the patients and the staff.
And one of the side effects of COVID-19 is the quarantine 15. How are you helping people with this?
In addition to offering services to help remove the fat, either surgical or non-surgical, we're also doing weight reduction classes, which we've actually been doing for a while, but probably more prevalent now with the COVID-15, that people are gaining the weight, and we can help them with that. We have a nurse that is also a diet expert, nutrition expert, and she'll help them with that process. We have a lot of patients that are starting to return, our regulars and some of our loyal patients, but many of them are a little bit concerned about undergoing surgical procedures. We have our own ambulatory surgery center, as you know, here, so I believe it's very safe. We've obviously followed all the protocols we need to. But for those that want to have non-surgical methods, we have the procedure called warm sculpting or sculpture. It's a treatment where we're using a laser. We put it on a certain area. This is a template that we use. We lay it on the areas where the fat needs to be reduced, and then we turn the laser on for 20 minutes, and it can reduce the fat in that area. So for those that don't want surgery or are not candidates for surgery, that might be a perfect option for them. And then we have the surgical procedure liposuction, which we do for the more definitive removal.
So with the non-surgical procedures, is there any downtime with these?
There's zero downtime with the non-surgical treatments. The patients are sitting there comfortably for about 20 minutes. Afterwards, we encourage them to be active. The more physically active, the better the circulation is to help remove the fat cells. So it actually is a good thing, but it could take up to 6 to 8 weeks for that fat cells to be reduced, and very often they'll come back for a second treatment to continue the process. We have the whole gamut of management. Some patients don't really need surgery or non-surgical, they just might need a little bit of direction with weight management, so we can help them with that. Other patients need to have more of our medical treatments, but the nice thing is we offer all of that here at the Aesthetic Associates Center. There are some centers and spas that offer the non-surgical methods, but as a surgeon, that's our forte. But when we can get away with something non-surgical, even better for the patient.
So you're ready to welcome people back?
We are. We're going full blast here. We're taking all the precautions as we talked about earlier, but I think it's really a great opportunity for people to come in and see us.